Everyone, to the OphthoKnight quiz show, the ultimate interactive challenge for ophthalmologists from around the world. Test your knowledge, compete, and win. Every week, we go live with a fast-paced, high-energy ophthalmology quiz. You'll face real clinical scenarios, rapid spot diagnoses, and investigative decision-making, putting your practical ophthalmology skills to the ultimate test. Compete against ophthalmologists worldwide in a quiz that's fast, challenging, and fully interactive. Here's how it works. Answer in the comments using only the number 1, 2, 3, or 4. Only one answer per question counts. Multiple submissions will be disqualified. Answer quickly. Don't wait for the full question to be read. The winner is the one with the most correct and fastest answers. Over the past weeks, hundreds of outstanding ophthalmologists have joined our quiz. Here are some of our brilliant winners. Look at those scores. Incredible work. And heartfelt congratulations to our champions. Maybe next time, it'll be you. Winners also receive a symbolic gift, but the real reward is sharpening your ophthalmology skills and competing with the very best. Are you ready to take the challenge? Subscribe to OphthoKnight, join the live quiz, and maybe your name will be the next on our winner's board. We go live every Friday at 11:30 p.m. Cairo time. To join, simply subscribe, turn on notifications, and be ready when the quiz begins. All you need is your knowledge and your speed. Join us live and see if you have what it takes to become the next OphthoKnight champion.
Welcome, everyone, to our live trivia show. Get ready to test your knowledge and sharpen your minds as we dive into the fascinating world of ophthalmology, the branch of medicine that deals with the eye, its diseases, and treatments. From corneal conditions to cutting-edge ocular surgery, we've got it all covered. There will be 25 questions. Each has 4 answer options, but only one is correct. The faster you answer, the more points you earn. To play, simply comment the number of the correct option or type the full answer. Remember, 25 questions, 4 options, speed matters, answer by number or full text. Avellino dystrophy involves abnormal deposits in the corneal stroma, quite rare. Correct answer, Congo red stain. 13 of 41 got it right. Shout out to @Riddle6712, @Amfau @4303, @8, @IDoctor7. Time for question 2. Let's test your microbiology knowledge. Which of these organisms can penetrate an intact corneal epithelium? 1. Pseudomonas aeruginosa. 2. Moraxella lacunata. 3. Group A Streptococcus. 4. C. Diphtheria. Think fast. This one's tricky but fascinating. Some bacteria are sneakier than they look. Choose wisely. Submit your answer now. Every second counts. Some bacteria can invade even healthy corneas, nature's microscopic ninjas at work. Correct answer, C. Diphtheria. Well done. 35 of 48 players answered correctly. Shout out to @Riddle6712, @Ogmetadel XW9UG, @SafeGMH, @IDoctor7. Question 3 coming your way. Let's dive into ocular emergencies. In chemical eye injuries, besides limbal ischemia, which sign suggests poor prognosis? 1. Severe conjunctival involvement of greater than 80%. 2. Raised IOP of 28 mm of mercury or more. 3. More than 2+ cells in anterior chamber. 4. Central epithelial defect of greater than 80%. Think carefully, this one's about long-term outcomes. Eyes under pressure, literally. Choose your answer now. The cornea has no blood vessels, it's nourished by tears instead. Correct answer, severe conjunctival involvement over 80%. Only 6 of 48 answered correctly. Shout out Mariam Kamal 1656, Amfau @4303, @Osamam.Mansour, @Nadia 6674. Question 4 now. Things are getting clinical and intriguing. A 25-year-old patient, 1 day post-penetrating keratoplasty, presents with a fixed dilated pupil and headache. Anterior chamber is deep and quiet, no ptosis, and the pupil doesn't respond to pilocarpine 2%. What's the next best step? 1. MRI head with contrast. 2. Check ocular motility. 3. Check IOP. 4. CT angiogram head. Time to think like a cornea specialist. Choose wisely. Almost there, your answer might just save vision. Pilocarpine 2% tests for 80's pupil. No response suggests something serious. Correct answer. Check intraocular pressure immediately. 42 of 46 players answered correctly. Great job @Riddle6712, @Mazzolo1775. Also Osame Biokala, @Osamam.Mansour. Well done. Question 5 coming in. Get ready, ophthalmology detectives. Which anterior segment dysgenesis links corneal glaucoma, craniofacial, and CNS abnormalities? 1. Trabeculodysgenesis. 2. Peters anomaly. 3. Axenfeld-Rieger syndrome. 4. Aniridia. Think syndromes, structure, and systemic clues. Choose your answer carefully. Eyes on the prize. Submit your best guess now. Peter's anomaly often presents with central corneal opacity at birth. Correct answer, Peter's anomaly. Well done. 22 of 50 players answered correctly. Shout out at Augmentadel XW9UG, at Mazzolo is 1775. Also at Mohammed Zayden 2791, at Great Job. Question 6 now, focus up, glaucoma gurus. A 59-year-old hypermetrope, high IOP, occludable angles, what's best? 1. Selective laser trabeculoplasty. 2. Peripheral iridotomy. 3. Peripheral iridoplasty. 4. Clear lens extraction. Think efficacy, cost effectiveness, what's the smartest move? Lock in your answers, strategy matters here. Clear lens extraction may lower IOP effectively in angle closure glaucoma cases. Correct answer, clear lens extraction, excellent choice. 19 of 51 players answered correctly. Bravo at Mariam Kamal 1656, at Asma Elmala 8745, sharp minds. Also at Osame Biokala, at Hababamani 2126, great work. Question 7, let's test your post-vitrectomy glaucoma knowledge. A 45-year-old diabetic man, post-vitrectomy, now has corneal edema, AC cells, IOP 45. No hyphema present, what's the most likely diagnosis? 1. Schwartz-Matsuo syndrome. 2. Red cell glaucoma. 3. Posner-Schlossman syndrome. 4. Ghost cell glaucoma. Think carefully, history and signs are key here. Submit your answers now, glaucoma sleuths, show your skills. Ghost cells are degenerated red cells seen after vitreous hemorrhage. Correct answer, ghost cell glaucoma, well done. 42 of 50 players answered correctly. Shout out at Riddle Masawi 6712, at Osama Biokala, great job. Also at Safe GMH, at Mazzolo is 1775, impressive glaucoma knowledge. Question 8, time to flex your pharmacology muscles. Which medication both decreases aqueous production and increases uveoscleral outflow? 1. Beta blockers. 2. Alpha-2 adrenergic agonists. 3. Prostaglandin analogs. 4. Carbonic anhydrase inhibitors. Think dual action, this one's a favorite in tricky cases. Lock in those answers now, glaucoma gurus. Alpha-2 agonists both lower IOP and increase uveoscleral outflow, dual action. Correct answer, alpha-2 adrenergic agonists, nice work. 41 of 52 players got it. Shout out at Mazzolo is 1775, at Riddle Masawi 6712, great job. Also at Osame Biokala, at Lathrate 5334, well played. Question 9, let's test your surgical planning instincts. During phaco, the posterior capsule ruptures. After anterior vitrectomy, you plan a sulcus IOL, no optic capture. The originally planned in-the-bag lens was plus 18.00D. What IOL power should you choose? 1. Plus 19.00D. 2. Plus 18.00D. 3. Plus 17.00D. 4. Plus 16.00D. Think about effective lens position, sulcus placement changes things. Time to lock in your answer. Sulcus IOL sit more anterior, adjust power slightly lower than in the bag. Correct answer, plus 17.00D, great job. 44 of 48 players answered correctly. Shout out at Lathrate5334, at Mohammedaid 1418, well done. Also at Osame Biokala, at Omnia Syed B3K, nice work. Question 10, let's dive into refractive outcomes. Which of the following is a potential cause for myopic refractive surprise? 1. Undiagnosed staphyloma. 2. Previous laser refractive surgery for hypermetropia. 3. Lower A constant. 4. All of the above. Think carefully, surprises after surgery aren't always pleasant. Lock in your best answer now. Myopic surprises often stem from inaccurate axial length measurements, double-check biometry. Correct answer, previous laser refractive surgery. 0 of 50 players answered correctly. Tough question, don't lose hope yet. Posterior capsular opacification is the most common complication after cataract surgery. Correct answer, polishing posterior capsule after cortex. 8 of 50 players answered correctly. Shout out at Mazzolo is 1775, at Osame Biokala, at Omnia Syed B3K, at Hababamini 2126. Question 12, let's dive into some refractive surprises with silicone oil. What effect does intravitreal silicone oil have in a pseudophakic eye? 1. Variable effect on refraction. 2. No effect on refraction. 3. It makes the refraction more hypermetropic. 4. It makes the refraction less hypermetropic. Eyes and optics, never a dull moment. Lock in your answers now. Silicone oil alters light refraction due to its different refractive index. Correct answer, refraction becomes more hypermetropic. 31 of 50 players answered correctly. Well done at Agmedadel XW9UG, at Mohammedaid 1418, at Osame Biokala, at Mohammed Mubarak 156. Question 13, time for some retinal rescue decision making. A 23-year-old man presents with an inferior macula on retinal detachment after blunt trauma. There's a retinal dialysis infranasally, no posterior vitreous detachment, and the lens is clear. What is the most appropriate primary surgical repair? 1. Vitrectomy with endolaser and gas. 2. Suprachoroidal buckle. 3. Scleral buckle and cryotherapy. 4. Pneumatic retinopexy. Think carefully, this one's a classic trauma scenario. Lock in your answers now. Retinal dialysis often occurs after trauma, especially in younger patients. Correct answer, scleral buckle and cryotherapy. 29 of 46 players correct. Shout out at Mazzolo is 1775, at Osame Diokala, at Lathrate 5334, at SafeGMH. Question 14, let's talk proliferative vitreoretinopathy grading. A patient has a long-standing total retinal detachment with fixed folds and a preretinal membrane anterior to the equator, spanning 4 clock hours. What is the PVR grade? 1. PVR CP4. 2. PVR CA4. 3. PVR B. 4. PVR A. Think fast, PVR grading can be tricky but crucial. Lock in answers now. PVR stands for proliferative vitreoretinopathy, a complication of retinal detachment surgery. Correct answer, PVR CA4, well done. 42 of 49 players correct. Shout out at Mohammed at 1418, at Osama.Mansour, at Mohammed Zayden 2791, at SafeGMH. Question 15, retinal tear location, based on detachment shading. Where is the most likely position of the retinal tear in the photo? 1. Superotemporal. 2. Superonasal. 3. Inferotemporal. 4. Inferonasal. Study the shaded area carefully, your answer might be hiding in plain sight. Retinal tears often occur opposite the detached retina's location. Think anatomically. Correct answer, superonasal. Nicely done, everyone. 32 of 51 players correct. Shout out at Omnia Magdi R7T, at Sene at 7313, at Riddle Mosawi 6712, at Muhammad Jamal 8488. Question 16. Time to test your retinal risk factor knowledge. Which of the following is not an associated risk factor for central retinal vein occlusion? 1. Longer axial length. 2. Hypertension. 3. High plasma viscosity due to blood dyscrasia. 4. Diabetes mellitus. Think carefully, one of these doesn't belong. Choose your answer now. CRVO often presents with sudden, painless vision loss. Watch for that clue. Correct answer, longer axial length. Well done. 51 of 52 players correct. Shout out at Mazzolo is 1775, at Riddle Mosawi 6712, at Amia Syed B3K, at SafeGMH. Question 17, let's light up those retinal pathways, shall we? Which of the following conditions can cause an electronegative electroretinogram, ERG, full field, bright flash and scotopic conditions? 1. X-linked retinoschisis. 2. Retinitis pigmentosa. 3. Best's disease. 4. Acute macular neuroretinopathy. Think fast, ERG patterns can reveal fascinating retinal secrets. Lock in your answer. ERGA wave reflects photoreceptor activity, key in retinal function testing. Correct answer, X-linked retinoschisis. Well done. 30 out of 50 players correct. Shout out at Sane at 7313, at Times Z4T, at Rust Shaman 9319, at Osama Ibiokala. Question 18, let's shine some therapeutic light on this one. Photodynamic therapy, using verteporfin, is a treatment option in all of the following, except 1. Polypoidal choroidal vasculopathy. 2. Macular telangiectasia type 2. 3. Choroidal hemangioma. 4. Central serous chorioretinopathy. Verteporfin's role varies. Choose wisely and lock in your answers now. Verteporfin targets abnormal vessels, used in selective retinal conditions only. Correct answer, macular telangiectasia type 2. Only 10 got it right, tricky. Shout out at SafeGMH, at Mazzolois 1775, at Lathrade 5334, at Osamam.Mansour. Question 19, let's get clinical and a little fruity. Which of the following fits with the description of multiple intraretinal blood-filled saccules with bunch of grapes appearance? 1. Racemose hemangioma. 2. Vasoproliferative tumor. 3. Cavernous hemangioma. 4. Capillary hemangioma. Picture grapes in the retina, locking your answers now, ophthalmology detectives. Cavernous hemangiomas are rare, often asymptomatic, and usually discovered incidentally on exams. Correct answer, cavernous hemangioma. Well done. 26 players nailed it, nice work. Shout out at Sane at 7313, at Lathrade 5334, at Riddle Mosawi 6712, at Mohammeday at 1418. Question 20, let's test your pharmacology finesse. In a patient with suspected tonic pupil, which of the following pharmacological tests is useful in establishing the diagnosis? 1. Topical pilocarpine 1%. 2. Topical pilocarpine 0.1%. 3. Topical cocaine 4%. 4. Topical aproclonidine 0.5%. Eyes wide open, choose wisely, future neuro-ophthalmology legends. Tonic pupil often reacts poorly to light but better to accommodation. Correct answer, topical pilocarpine 0.1%. Impressive. 46 players got it right. Shout out at Mazzolois 1775, at Mohammeday at 1418, at Lathrade 5334, at Ahmedadel XW9UG. Question 21, diagnostic decisions ahead. In a patient with suspected ocular myasthenia, which of the following tests would you perform next? 1. Tinselin test. 2. Ice pack test. 3. Chest x-ray. 4. CT scan of head. Eyes on the prize, locking your answers now, clinical detectives. Ice pack test can temporarily improve ptosis in ocular myasthenia cases. Correct answer, ice pack test. Well done. 46 players answered it correctly. Shout out at Mohammed Zayden 2791, at Mazzolowis 1775, at Ahmedadel XW9UG, at Omnia Sayed B3K. Question 22, TikTok, time for trivia. Erythema chronica migrans is associated with which following organism? 1. Treponema pallidum. 2. Leptospira interrogans. 3. Borrelia burgdorferi. 4. Bartonella henseli. Think fast, infectious clues are crawling your way. Erythema chronica migrans often appears as a bullseye-shaped skin rash. Correct answer, Borrelia burgdorferi. Great job! 40 players got it right, impressive. Shout out at Mazzolowis 1775, at Rust Shaman 9319, at Mohammeday at 1418, at Lathrate 5334. Question 23, let's keep those scores climbing. Which eyes with retinopathy of prematurity can be followed conservatively? 1. Zone 2, Stage 3 without plus disease. 2. Zone 2, Stage 2, with plus disease. 3. Zone 1, Stage 3 without plus disease. 4. Zone 1, Stage 3 with plus disease. Premature vision, complex zones, choose wisely, future ophthalmologists. Plus disease indicates worsening retinopathy with dilated, tortuous retinal blood vessels. Correct answer, Zone 2, Stage 3. 34 players answered correctly, well done. Shout out at Mohammeday at 1418, at Ahmedadel XW9UG, at Rust Shaman 9319, at SafeGMH. Question 24, getting close to the finish line. Which strabismus type shows stable deviation angle? 1. Uncorrected anisometropia. 2. Nystagmus blockage syndrome. 3. Microtropia. 4. Convergence excess esotropia. Eyes may wander, but your answers shouldn't. Lock them in now. Microtropia often goes unnoticed due to small angle and strong fusion. Correct answer is microtropia, well done. 42 got it right, impressive. Shout out at Riddle Mosawi 6712, at Mohammeday at 1418, at Osaman.Mansour, at SafeGMH. Final question, let's finish strong, everyone. Which feature suggests bilateral superior oblique palsies? 1. Prominent A pattern. 2. Excyclotorsion greater than 10 degrees. 3. Chin-up head posture. 4. Bilateral failure of abduction and depression. Trust your instincts, lock in those final answers now. Superior oblique palsy often causes vertical diplopia and compensatory head tilt. Correct answer is excyclotorsion greater than 10 degrees. 25 players got it right. Nice. Shout out at Mazzolo is 1775, at Riddle Masawi 6712, at Mahmoud Hamida 8858, at Abdullah X4H9F. What a game! 59 players brought their A game today. Congrats at Osamam.Mansour, our champion with 24. At Lathrate 5334, at Mahmoud Hamida 8858, and more stellar performances all around. Thanks for playing. See you next trivia.